if I told you that the same class of weight loss medications responsible for the whole Ozempic face trend is quietly driving a massive surge in a really highly intimate cosmetic procedure.
You'd probably wonder what the connection actually is, right?
Exactly. Because we tend to think of targeted weight loss, but biology doesn't really discriminate based on anatomy. When the body drops weight rapidly, fat pads shrink everywhere, and that includes the delicate structural tissue of the vulva.
Right, which creates this sudden anatomical deficit. It leaves many women in genuine physical discomfort, searching for a medical solution to a problem they honestly didn't anticipate.
And that is exactly what we are exploring for you today in this deep dive. We're getting into the rapidly expanding world of intimate aesthetics, specifically a procedure known clinically as labia majora augmentation, or, more casually, labial puffing.
Yeah, and we are zeroing in on a very specific, practical question that just keeps coming up in the research. Can you safely get labial fillers to fix this discomfort before you have children? Or is it biologically and practically better to wait until your family is complete?
To answer that for you, we are synthesizing a pretty dense stack of medical literature today. We've pulled procedural breakdowns from leading cosmetic gynecology clinics, like Center for Surgery, G Plus Clinic, and the Beyond Collective.
But we're also balancing all that clinical enthusiasm with some very urgent safety consultations and warnings,
Yeah.
specifically from regulatory bodies like the British Association of Plastic, Reconstructive and Aesthetic Surgeons, or BAPRAS, and the UK government.
Because, anytime we talk about altering anatomy, especially in an area so tied to future life events like childbirth, we have to separate the marketing from the biology.
Absolutely.
And before we can figure out the timeline of when to get this done, we need to clarify what is actually happening to the tissue. There's this persistent cultural habit of lumping all intimate cosmetic procedures under the umbrella term designer vagina, which...
It's just incredibly dismissive of what the clinical sources are describing.
Totally.
That phrase completely masks the anatomical reality. It reduces a structural, functional medical procedure to just a trivial vanity project. The first distinction we really have to make is between labiaplasty and labial puffing, because they are biological opposites.
Okay, break that down for us.
So labiaplasty is a surgical reduction. It involves cutting away excess tissue from the inner lips, the labia minora. Labial puffing, on the other hand, is additive. It's a non-surgical augmentation of the outer lips, the labia majora, designed to restore lost volume.
So you're not altering the shape of the inner anatomy. You're basically trying to rebuild the outer housing.
Exactly, you're rebuilding the protective scaffolding. The labia majora act as the body's native biological cushion for the much more delicate, highly innervated inner anatomy.
Right, and I'm looking at the patient profiles in these clinic notes, was trying to understand why that scaffolding breaks down in the first place. Aging and menopause are listed as the primary drivers. When a woman enters perimenopause, her estrogen levels plummet. How does that systemic hormonal drop physically deflate that specific outer cushion?
Well, estrogen is heavily responsible for maintaining collagen production, skin elasticity, and the distribution of localized fat pads. So when systemic estrogen drops, the fibroblasts,
The cells that make collagen.
right, the cells responsible for generating collagen, they slow down. The structural matrix of the skin weakens, and the fat cells in the labia majora actually begin to atrophy. The tissue literally thins out, loses its bounce, and just becomes deflated.
Wow.
And, the same structural degradation occurs from the sheer physical trauma and stretching of childbirth.
Which brings us back to the weight loss drugs we mentioned at the top. The notes from Dr. Haleparn's clinic emphasize this whole new wave of patients experiencing extreme volume loss without necessarily aging or giving birth.
Yeah, the mechanism there is purely metabolic. Fat cells, or adipocytes, act like tiny metabolic storage balloons. When you lose massive amounts of weight very quickly on a GLP-1 medication, those fat cells don't disappear. They just rapidly empty their lipid stores.
The balloons deflate.
Exactly. And because the skin hasn't had time to slowly retract, you are left with hollow, deflated tissue, whether that's in the cheeks of your face or the labia majora.
So you're losing the actual biological scaffolding. It's not just a superficial skin elasticity issue. The structural support is literally melting away. And the clinical pages are very clear that the absence of this cushion isn't just an aesthetic concern. These women are coming in because they're in pain.
Oh, the functional fallout is significant. Without the protective volume of the labia majora, the delicate inner labia are exposed to constant friction. Patients report chronic, painful chafing during basic physical activities.
Like cycling or running.
Right. Cycling, running, horseback riding, Or simply wearing standard clothing like jeans or workout gear becomes actively painful. Restoring the volume natively protects the inner anatomy, providing immediate functional relief.
I mean, if the pain is that acute, it completely reframes the timeline, which leads us to the core question of our deep dive. Let's say a younger woman experiences this severe volume loss, maybe from rapid weight loss, or perhaps she just naturally lacks that protective volume, and she wants this functional relief now.
Right.
But she hasn't had children yet. The idea of injecting filler into a highly sensitive area, knowing she plans to push a baby out of that exact same anatomical neighborhood a few years down the line, it sounds inherently risky.
Well, from a strict physiological standpoint, the clinical consensus, including detailed statements from G+ Clinic, is that it is entirely safe. There is absolutely no fundamental medical conflict between having a labial filler and later undergoing natural childbirth.
I just struggle to visualize how those two events don't collide. Childbirth is a massive trauma to the pelvic floor. How does a synthetic filler sitting in that tissue not interfere with delivery?
It comes down to the distinct layers of the anatomy. The labial puff is a superficial procedure. The dermal filler is injected into the very shallow subcutaneous layers of the outer skin folds.
Oh.
Natural childbirth, on the other hand, relies on the deep muscular expansion of the vaginal canal and the underlying pelvic floor muscles. The superficial filler sitting in the outer skin does not physically impede, block, or restrict that deep muscular elasticity required to safely deliver a baby.
Okay, so you can safely have the procedure. But reading through the actual consultation advice from these clinics, there's a massive practical caveat. Just because the filler won't harm the baby or stop the delivery doesn't mean it's a good investment of your time or money before pregnancy.
No, not necessarily. Ethical practitioners heavily emphasize family planning during the initial consultation because pregnancy is an ultimate systemic biological disruptor. It's not just the physical stretching of delivery.
All right, there's so much more going on.
Exactly. During pregnancy, a woman's blood volume increases by up to 50%, heavily concentrated in the pelvic region. You have unprecedented surges in hormones like relaxin, which softens ligaments and tissues. You have inevitable weight fluctuations.
So those profound shifts are going to interact with whatever filler you placed there beforehand. And since the most common fillers used are hyaluronic acid, which are temporary, wouldn't a pregnancy basically overwrite the procedure entirely?
The interaction is heavily counterproductive to the filler's longevity, yeah.
Well,
Hyaluronic acid naturally metabolizes over 6 to 18 months. The increased pelvic blood flow and heightened metabolic rate during pregnancy can actually accelerate the breakdown of that filler.
wow.
And even if the filler somehow survives the metabolic furnace of pregnancy, the physical stretching and hormonal softening of the tissue will permanently alter the baseline shape of the labia anyway. The result you paid for will simply not exist postpartum.
You are essentially trying to beautifully landscape a front yard right before a massive construction crew rolls in to renovate the house.
That's a great way to put it.
It's technically possible,
Yeah.
but the results are going to get trampled. So a patient has to weigh the severity of her immediate daily pain against the financial reality that the thousands of dollars she spends will likely be wiped out when she gets pregnant.
It becomes a purely individual cost-benefit analysis. A woman unable to comfortably exercise today might decide 12 to 18 months of relief is absolutely worth the investment. She fully accepts she will lose the aesthetic and functional result during a future pregnancy.
Sure.
But for long-term predictability, the surgical sources strongly recommend waiting until your family is complete so the clinician is working with your permanent, stabilized baseline anatomy.
And we must emphasize a hard medical boundary in the sources here. You absolutely cannot circumvent this by getting top-ups during the pregnancy.
No, that is a strict universal contraindication. No reputable medical professional will perform elective cosmetic injections on a pregnant or breastfeeding woman.
Right.
Clinics like Center for Surgery require patients to wait at least 3 to 6 months post-delivery and fully finish breastfeeding before even assessing the tissue for a procedure. Hormones, blood volume, and body weight must return to a stable baseline first.
Let's assume the listener has factored in the pregnancy timeline. They either accept the temporary nature of the fix or they've waited until their family is complete. How are practitioners physically restoring this lost structural cushion?
Well, the sources point to 2 distinct methods that seem to operate on entirely different biological principles.
Right. The first is hyaluronic acid, or HA fillers, using specific brands like Deserial or Naviovia Rose.
And hyaluronic acid is often misunderstood as a foreign chemical, but it's a complex sugar molecule naturally synthesized by our own bodies. Its primary biological function, whether in our joint fluid, our eyes, or our skin, is to act as a humectant. It aggressively attracts and retains ambient water.
So instead of just taking up physical space like a solid implant, it's acting more like those little silica gel packets you find in shoeboxes. But like in reverse, pulling surrounding moisture into the tissue instead of drying out the environment.
That is exactly how it functions on a molecular level. It is hydrophilic. When injected into the deflated labia, the HA gel instantly draws in local water. This provides the immediate structural volume needed to stop the chafing, but the secondary biological benefit is profound internal hydration.
Which is huge.
It is. It actively combats the chronic vaginal and vulvar dryness that causes so much secondary discomfort during menopause.
And looking at the chemical breakdown of products like Deserial, these aren't just the standard fillers a dermatologist uses for cheekbones. They're engineered specifically for intimate tissue.
The formulation must account for the unique mechanical stress and density of the vulva. Deserial incorporates an antioxidant called mannitol, which slows the rate at which the body breaks down the hyaluronic acid, extending the life of the hydration.
And Uvea Rose includes specific amino acids, right? Glycine and L-proline.
Exactly, which are the fundamental building blocks for new collagen formation. The procedure itself is minimally invasive, taking roughly 20 minutes under local anesthetic with virtually no downtime. But as we establish, the body will eventually clear that sugar molecule, requiring maintenance treatments every 12 to 18 months.
Which naturally leads someone to ask for a permanent solution. If a patient doesn't want to rely on temporary silica gel packets that dissolve every year, the sources outline option 2, which is autologous fat transfer. This fundamentally shifts the procedure from a quick injection to actual surgery.
It requires a much higher clinical threshold. Autologous fat transfer involves microliposuction to harvest the patient's own fat, typically from the abdomen or inner thighs. That harvested fat is placed in a centrifuge to separate the viable lipid cells from blood and numbing fluid.
Okay.
The purified fat cells are then carefully grafted back into the labia majora using a cannula.
So you are taking your body's energy storage system and physically relocating it. But here is the biological variable that jumps out at me.
Yeah.
If you relocate fat cells to the labia, do those cells know they are in a new location, or do they behave like they are still on the stomach?
They maintain their original metabolic programming. The cellular lineage doesn't change just because the zip code did.
Wait, really?
Yeah. So if a woman opts for a labial fat transfer before having children and then gains 30 or 40 pounds during a subsequent pregnancy, those grafted fat cells in her labia will aggressively expand to store lipid energy, just as they would have on her abdomen.
That is wild.
And if she later loses the weight, they will shrink. The grafted volume fluctuates directly in tandem with systemic body weight.
That is a staggering biological reality to consider. Your intimate anatomy could literally expand and contract with your overall body mass index for the rest of your life.
It really is something to think about.
Beyond permanence, is there a biological advantage to moving living tissue rather than using HA filler?
The real advantage is cellular regeneration. When you harvest fat, you aren't just moving lipid storage, you are moving the stromal vascular fraction, or SVF.
What does that do?
The SVF is a cellular soup rich in adult stem cells and growth factors. When introduced into aging, thinned labial tissue, these cells trigger angiogenesis, which is the formation of new blood vessels. They signal local cells to produce fresh collagen.
Oh, wow.
You are essentially grafting a living regenerative engine into the tissue, actively improving the long-term elasticity and health of the overlying skin, far beyond simply filling an empty space.
It's the difference between watering a wilting plant to make it temporarily stand up versus repotting it in entirely new, nutrient-rich soil. It sounds incredibly effective, which actually brings us to the most jarring part of our source stack.
The regulation.
Yeah. If this is just utilizing naturally occurring sugars or the patient's own fat, why are regulatory bodies like BAPRAs issuing urgent safety crackdowns? The marketing sells this as a simple lunchtime puff, yet the UK government wants these dermal fillers legally reclassified from medical devices to prescription medicines.
The push for reclassification stems from a dangerous disconnect between the accessibility of the syringe and the severe complexity of the anatomy. Currently, in many regions, dermal fillers are regulated simply as medical devices, much like a scalpel.
But a scalpel doesn't stay in your body.
Precisely. Filler, however, is a biological implant that alters human physiology. When the legal barrier to purchase and inject these substances is low, inexperienced practitioners enter the market treating the vulva like a simple, empty balloon waiting to be filled.
And the vulva is anything but a simple empty balloon.
It is a dense, highly intricate web of major blood vessels, delicate mucosal tissue, and vital sensory nerve networks, including the clitoral and urethral structures.
Let's follow the biology of an inexperienced injection. If a practitioner without a deep surgical understanding of pelvic anatomy pushes a thick gel filler into the wrong millimeter of tissue, what actually happens beneath the skin?
The most catastrophic outcome is vascular occlusion. If the needle tip pierces a blood vessel, the practitioner can accidentally inject the thick filler directly into an artery. Alternatively, they can inject so much filler around a vessel that the external pressure compresses the artery shut.
In either scenario, the oxygenated blood supply to that specific region of tissue is instantly choked off.
Yes. If the injector doesn't recognize the signs immediately and dissolve the filler with a specialized enzyme called hyaluronidase, the starved tissue will undergo necrosis. It will literally die, turn black, and slough off.
You're risking permanent disfigurement to fix chafing.
To disfigurement and sensory destruction. We noted the density of nerve endings in this area. A misplaced needle, or the chronic inflammation caused by injecting too much product, can traumatize the clitoral nerve network, resulting in permanent numbness or altered sexual sensation.
That's terrifying.
And furthermore, if the body detects the filler as a threat due to poor injection technique, it can wall the material off. That creates hard, painful nodules called granulomas that require surgical excision.
The quote from Dr. Hale-Parn's source material summarizes this perfectly. The biggest risk isn't the hyaluronic acid, it's an inexperienced injector. It places a massive burden of critical thinking onto the consumer.
The patient absolutely must overcome the deceptive marketing. A non-surgical procedure is still a highly invasive medical event. Placing a foreign substance into a highly vascular, profoundly sensitive anatomical zone demands the exact same rigor, respect, and anatomical mastery as open surgery.
Which brings us back to where we started, synthesizing all of this for the listener trying to chart a course. Can you safely get labial fillers before having children? The biology says yes, superficial fillers won't prevent you from delivering a baby.
But the practical reality says you are racing a metabolic clock. If your daily physical discomfort from chafing or deflated tissue is severe enough, the temporary hydration and structural relief of hyaluronic acid might be worth the investment right now.
But you have to go in knowing that the massive hormonal shifts, increased pelvic blood flow, and physical stretching of a future pregnancy will almost certainly degrade or completely overwrite those results.
Right. And if you are seeking the permanent regenerative benefits of a fat transfer, the clinical consensus is resolute. Wait until the profound physiological disruptions of pregnancy are entirely behind you, so the practitioner is working with a stable, predictable anatomical foundation.
And regardless of the timeline, demand a board-certified specialist who intimately understands the vascular roadmap of the pelvic floor to ensure you aren't trading temporary discomfort for permanent nerve damage.
Exactly.
It's a complex medical decision masked as a quick cosmetic fix. And it leaves us with a broader question to consider as these treatments become increasingly normalized.
Well, we are watching the biological realities of weight loss, hormonal aging, and childbirth being medically engineered away in our most intimate anatomy.
Yeah.
As the perfectly plumped, aesthetically restored labia becomes heavily marketed on social feeds, what kind of anatomical baseline are we establishing for the next generation of young women? Long before they even begin to experience the natural changes of having children, are we quietly shifting the expectations so that normal biological aging is viewed as a deficit that requires a syringe to fix?
It's a question worth turning over the next time you see a quick lunchtime fix advertised.
Yeah.
Thank you for diving deep with us today. Keep questioning the simple narratives and never stop your pursuit of being well-informed.